Okay, so you want to be an NICU nurse, right? And you're getting ready for those interviews. It's more than just knowing the medical stuff, though, isn't it? We took a deep dive into this YouTube video, NICU nurse interview questions and answers. It's a mouthful, I know. But it's got some seriously good advice. And we wanted to, like, unpack it a bit, go beyond just the surface level of those typical answers.
It's true. You can't just have those canned responses. Interviewers, especially in the NICU, they can see right through that.
They're looking for that genuine passion, aren't they?
Absolutely. They want to see the heart of an NICU nurse. That empathy and resilience, you can't fake that.
It's like they want to see that spark in you, that genuine, I don't know, like calling to this kind of care.
Right.
And the video, it really emphasizes nailing that tell me about yourself question right away.
Yeah. First impressions matter. That's your moment to set the tone and show them who you are beyond, what's on your resume.
So like, why this path? Why you?
Exactly. They want to know you're not just qualified on paper, but that you'll actually thrive in that environment. Because let's face it, the NICU, it's intense, high pressure, heartbreaking at times.
Yeah.
You need to show them you're ready for all of that.
They gave us example answer in the video, and I thought it was really interesting. They talked about being dedicated and compassionate and having a calm demeanor.
Classic NICU buzzwords for a reason.
Right. It's like they have a checklist.
In a way, they do. Because you're dealing with the tiniest, most vulnerable patients and their families who are going through, well, it's an incredibly intense experience. It takes more than just medical expertise.
It's about being that steady presence for them.
Exactly. A source of comfort and strength, even when things are chaotic.
So when you're coming up with your answer, really think about how your experiences show those qualities.
Right. Like, have you ever had to stay calm under pressure when everything around you felt like it was falling apart?
Or how you offered support during a really tough time. Those are the stories that will resonate with them.
Absolutely. And don't be afraid to get specific. Instead of just saying, oh, I'm compassionate, tell them about a time you went above and beyond to comfort a patient's family, or when you advocated for a child's needs, even when it was difficult.
Those real-life examples, they paint a picture.
Exactly. Show them you're not just prepared for the technical stuff, but for the emotional roller coaster that comes with the NICU.
Yeah.
Because that's where the real heart of this job lies.
It does. Makes you think about those times when compassion meets, like, really tough situations. The video mentions those curveball questions, like dealing with difficult families.
Yeah.
I know about you, but those always make me nervous.
Oh, absolutely. Those can be tough.
Just hearing about them.
But they're not trying to trip you up,
Okay, good.
It's more about seeing how you handle the unexpected because, let's be honest, the NICU, it's a pressure cooker of emotions. You've got parents who are sleep deprived, they're scared, they're making incredibly difficult decisions for their child. Tensions are going to run high sometimes.
And you have to navigate that with both empathy and professionalism.
Exactly.
Which I imagine is like a really tricky balance to strike sometimes.
It can be.
The video even had this scenario where a family refused a certain treatment because of their religious beliefs. And I was like, oh my gosh, how do you even begin to approach something so sensitive? But at the same time, you've got to make sure that baby is getting the best care possible.
Right, and that's where those core communication skills are so important.
Yeah.
It's about active listening, really trying to understand their perspective.
Right.
And then finding a compassionate way to explain the medical necessity.
We don't. Yeah.
While still respecting their beliefs.
Yeah.
Because you're not there to judge, right? You're there to advocate for that child and support the family as best you can within those boundaries.
It takes a different kind of resilience, I think, to stay calm and focused in those moments, especially when you're also dealing with all the clinical demands of the NICU.
Oh, absolutely. It's like you're flexing a different kind of muscle.
Right.
One that requires that emotional intelligence, that deep well of empathy.
And the interviewers, they're looking for that, aren't they?
Oh, 100%. They want nurses who can handle those high-stress situations without becoming overwhelmed or, letting their emotions cloud their judgment. Because ultimately, it's about making the best decisions for those babies.
And then on top of all that, the video talked about conflict with coworkers.
Ah, yes.
Which can be a whole other minefield, right?
It's true. It's true.
I mean, we've all worked with somebody who's difficult at some point.
Yeah.
But in the NICU, it's like those interpersonal dynamics, they have even higher stakes.
Absolutely, because teamwork is everything in the NICU.
Yeah.
You're not in it alone.
Yeah.
You're part of this team that's responsible for these tiny, precious lives.
Right.
So they want to see that you can communicate effectively, you can respectfully address disagreements, and that you're ultimately there to work collaboratively towards the best possible outcome for those infants.
There's no I in team,
Right.
like check your ego at the door.
Exactly. Put those personal feelings aside.
Mm.
It's about the patients and their families, first and foremost.
So they're looking for signs that you can be a team player even when things are tough.
Absolutely. And that takes a certain level of maturity, self-awareness.
Right.
They want to see that you can handle constructive criticism, you can work through disagreements professionally, and that, at the end of the day, you're prioritizing the well-being of the unit as a whole.
Because that builds trust, right?
Exactly.
Yeah.
Not just with your colleagues, but with the families who are entrusting you with, let's be honest, their most precious gift.
Yeah.
They need to know you're a source of stability, of support, no matter what's going on.
Wow. It's like you're proving you can be that steady hand at the wheel even when everything feels like it's a storm around you.
Precisely.
It's a lot to think about.
It is.
But I guess that's the reality of working in such a high-stakes environment. It's not just treating patients. It's this whole other level of navigating emotions, ethics, interpersonal dynamics.
It's a lot, but it's also incredibly rewarding. You have the opportunity to make a real, tangible difference in the lives of these vulnerable infants and their families, and I can't think of anything more rewarding than that.
You're right. It's a privilege to do this work. And I think sometimes it's easy to forget that when we're so focused on the day-to-day challenges.
I agree.
So to do it effectively, it's more than just the medical expertise, right? It's the compassion, the resilience, this unwavering commitment to providing the best possible care, both clinically and emotionally.
You got it. And speaking of compassion in action, the video also touches on the importance of cultural sensitivity in the NICU.
Oh, yeah, that's so important.
Because you're working with families from all walks of life, each with their own unique beliefs and customs. And that can sometimes impact healthcare decisions.
It's true, and it's something you might not always think about when you're so focused on, the medical charts and the treatments.
Right.
I remember reading an article about how cultural beliefs around breastfeeding can vary so widely.
Oh, absolutely.
And how important it is for healthcare providers to be sensitive to those differences, not just assume everyone approaches it the same way.
It goes way beyond breastfeeding, though. Think about end-of-life care, religious practices, even just how families interact with their babies. All these areas where cultural sensitivity plays a huge role in building trust and ensuring families feel heard and respected.
Which can be daunting, right? Especially if you haven't had a lot of experience with diverse cultures. Like, where do you even begin?
Right, but the video made a good point. It's not about being an expert on every single culture out there. That's impossible. It's more about demonstrating that you're aware of these differences, that you're willing to learn, and that you're committed to providing what they call culturally competent care.
I like that, culturally competent care. So it's more about the approach, that willingness to ask questions, educate yourself, and adapt to meet each family's unique needs.
You got it. Show them that you respect their beliefs and that you want to partner with them to provide the best possible care for their child.
Like you're building bridges, creating that space where families feel safe and understood, even if there are language barriers or cultural differences.
Exactly. And that takes empathy and sensitivity, recognizing that every family's experience is unique and your role is to support them in a way that honors their values and beliefs.
It reminds me of that quote, people may forget what you said, but they will never forget how you made them feel.
I love that.
And in the NICU, where emotions run so high, that feeling of being seen, being heard, being respected, it can make all the difference in the world.
Absolutely. It highlights how important it is to not just focus on the technical parts of the job, but to really cultivate those interpersonal skills. That's how you connect with families on a deeper level.
So for anyone listening who's maybe feeling a little overwhelmed by all this talk of compassion and resilience and cultural sensitivity, remember, you don't have to be perfect. Nobody's expecting you to have all the answers. It's more about being genuine, being willing to learn, and really being passionate about providing the best possible care for these tiny humans and their families.
Couldn't have said it better myself.
Yeah.
And it brings us back to the heart of this whole deep dive. Acing that NICU nurse interview, it's not about having a perfect response for every single question. It's about showcasing who you are.
Yeah.
Let that genuine empathy shine through, that dedication to this field.
It really is about showing them who you are at your core. And that, it made me think about those classic interview questions like, where do you see yourself in 5 years? But in the context of the NICU, it feels different,
It does, doesn't it?
Yeah.
It's not just about climbing that career ladder. It's more about how your own aspirations fit into that bigger picture of neonatal care.
Like, are you in it for the long haul?
Exactly. Do you see
Right.
yourself growing alongside the NICU, the families, even your own professional development?
And even if you totally ace the interview, you get the job. It's not like the learning stops there,
Oh,
right?
absolutely not.
Yeah.
This field is constantly changing. New research, new technologies, always something new to learn. And being willing to keep learning, that's what makes a truly great NICU nurse.
So what advice would you give to someone, our listener, to really thrive in this environment? Not just survive, but truly thrive. How do you cultivate that resilience, that compassion, that dedication?
For me, it boils down to three things:
Yeah.
self-care, continuous learning, and mentorship.
Oh, okay. I like it. Break it down.
So first, self-care. It's crucial. You can't pour from an empty cup, right?
Right.
The NICU, it's emotionally draining.
Yeah.
You have to prioritize your own well-being so you can be there for those babies and families. Find those healthy ways to de-stress, process those tough experiences, and recharge.
It's like that saying, put your own oxygen mask on first. You can't help anyone else if you're not taking care of yourself.
Exactly. And then continuous learning. Stay updated on new research, go to conferences, shadow more experienced
Yep.
nurses.
Never stop learning. Right.
Never stop learning. The more you know, the more confident you'll be, and that confidence, it translates into better care.
Makes sense.
And finally, find a mentor, someone who's been there who can offer guidance, support, especially when things get tough.
It's like having that experienced voice in your ear, that reassuring presence saying, you've got this.
Exactly. Having a mentor can make all the difference.
Wow. This deep dive has been, I don't know about you, but I feel like I learned so much.
Me too. It's been great.
We talked about compassion, resilience, cultural sensitivity, the importance of continuous learning. It's clear that being a truly amazing NICU nurse, it's more than just what's in your textbooks.
It really is. It's that unique blend of head and heart.
And for anyone listening, getting ready for those interviews, remember what we talked about. Showcase who you are. Let that passion shine through. You've got this. And until next time, keep diving deep.